Now, today is World Diabetes Day, and it provides an opportunity to raise awareness about diabetes as a critical global public health issue and emphasize the collective and individual actions needed to improve the prevention, diagnosis, and management of the condition. This year's theme, Breaking Barriers, Bridging Gaps, underpins our commitment to reducing the risk of diabetes and ensuring that all people who are diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. Now, from around the World Diabetes Day, National President Diabetes Association of Nigeria, Dr. Ejiofor Ugwu, is joining me on the news. Thank you so much for joining me on TVC News at 1. Talk to us about the significance of marking this day, especially when it comes to the issue of diabetes, which affects many, not just in Nigeria, but across the world.
Thank you very much. Good afternoon. I'm delighted to join you. As you rightly said, today, the 14th day of November, is World Diabetes Day. It is a United Nations Day that is designated to bring home the message of the ravaging diabetes epidemic. It is no longer news that diabetes is a global epidemic, currently affecting about 507 million people all over the world and still rising. In Nigeria, about 6 to 8 million Nigerians are currently living with diabetes, and this represents only a tip of the iceberg because most people with diabetes in Nigeria are not yet diagnosed. Now, coming to the significance of today's event, the World Diabetes Day has been in existence since 1991. It became a global, a United Nations Day in 2006. And what the message is all about is to create awareness about diabetes, to make sure that everybody in the world gets to know about the existence of this chronic metabolic disorder known as diabetes mellitus, the consequences of having diabetes, possible complications that will arise if it is not well managed, and also to let people know that diabetes is not a death sentence. Anybody who has got it of living his fullest life, up to the lifespan that God has put in for that person. The most important thing is to make sure that the condition is well controlled, is well managed. And it's also important to know that diabetes is preventable. So, World Diabetes Day is an opportunity to discuss the preventive strategies for diabetes. Diabetes is largely a lifestyle disease that is preventable. Now, one of the significance of a day like this is also to let government know and policymakers the barriers to care. Like you rightly said, this year's theme is breaking barriers and bridging the gaps. It's aimed at making sure that everybody living with diabetes all over the world has access to quality diabetes care. In Nigeria, for instance, there are several barriers to care that if you give me opportunity to enumerate some of them, I'll be glad to do so. Thank you.
Yes, so we would like you to definitely enumerate some of them, but because we have limited time, but I'm quite interested in how this presents itself, this condition presents itself. Is it based on the culture of our, food intakes and some of the things that we take due to maybe the economic situation in the country, and then people just take things the way they want it, and then they present with this condition of diabetes, which affects many?
Well, that's one of them. One of the drivers of the diabetes epidemic is unhealthy diet, like you just rightly mentioned. So people now eat a lot of junk food, a lot of sugar-sweetened beverages. People have, shy away from the traditional staple foods of our forefathers, and they are now embracing refined foods, and this is helping to fuel the prevalence of diabetes. But besides diet, diabetes is also related to the high prevalence of obesity and overweight. So the fatter you are, the more likely that you develop diabetes, because obesity leads to what we call insulin resistance. The body is able to make insulin, but the insulin cannot, is not working, and that's what we call insulin resistance. So another factor which is very important is sedentary living, that is lack of exercise, which is very common these days because electronic machines have taken over most of our manual labor, and so many people use sedentary lifestyle. So these are some of the major things that are fueling the diabetes epidemic. Now, coming to barriers to care, access to diabetes care in Nigeria, the number one thing I want to mention is the high cost of diabetes care in this country. The cost of medications have become exponentially high to the extent that they are now unaffordable to most people living with diabetes. I'll give you an example. There's a lifesaver, an injection we call insulin that most patients living with diabetes utilize. That insulin used to cost about 4,000 naira, but currently it's about 18 to 22,000. And so the cost of diabetes care now is about 80 to 100,000 naira per month for an average person living with diabetes. And most patients cannot afford it. Because of that, majority have resorted to alternative outlets, including herbal medicines, prayer houses, and we know the dire consequences of this type of practice because those people will just progress to complications and then premature death. Now, apart from the high cost of medication, another barrier is manpower. We are seriously lacking manpower. The specialists who manage diabetes in this country, endocrinologists, are very few, just about 200 or less to manage a population of over 200 million people. And this is creating a huge gap to care, especially in rural areas and semi-urban areas where these specialists are almost non-existent. So, and the other barrier is the lack of essential.
Yeah. Well, because of our time, I know you can go on and on because of our time. We're actually out of time, but most definitely we engage in this conversation, and as the day continues to unfold, National President, Diabetes Association of Nigeria, Dr. Ejiofor Ugwu. Thank you so much for your time. Thank you.
It's my pleasure, sir. Thank you very much.